Okay, let me break it down for you.
Judgment, prejudice, bias, it all still exists.
If I want to take this huge, overwhelming problem, I have to start with myself.
Finally clicked for me.
Compassion is a necessity.
Sangla is the biggest public ER hospital in Bali. This is Sangla. It's also one of the largest trauma centers in all of Indonesia. It's nationally renowned as the Hospital of Excellence. Last year, I started a work experience program there with Michelle Rosetto. She's sitting over there. You can clap if you want. Michelle is an Australian nurse who's been volunteering in Sangla, trying to improve the quality of care in the emergency room there. On my first day, as I walked through the emergency room, I saw what it really looked like to be living in a developing country, something that I didn't notice before. Every day, people are dying in the emergency room in Sangla of daily injuries and illnesses that in other countries like the West are easily treatable. I saw and experienced plenty of crazy stuff in my time at Sangla. One of them being an old fisherman walking in with a giant hook about the size of my arm in his chest. And he was so stoked. He was super calm, didn't care. He just unzipped his jacket and was laid on the stretcher and was like, "Hey, doctors." And he didn't die. So it was okay. But my first, most memorable experience in the hospital was the first day I was there, and I experienced one of the most common But my first, most memorable experience was with the family involved in an all-too-common motorcycle accident. A woman, her husband, and their infant son ran into the back of a truck when it stopped suddenly in front of them. The child died instantly, and the father came away with a few broken bones, and the mother suffered from a broken femur, shattered pelvis, and several other broken arms and legs, and several other external and internal injuries. She was on the verge of death. She had no idea who I was and what the hell some teenage white girl was doing standing at the side of her bed, but as the doctors worked her up, she grabbed hold of my hand and kept me there until they finished, and I nearly fainted. Some of these experiences were depressing, and they scared me, but many of them were inspiring, and they encouraged me to go on into my nursing career. Things like watching a baby born for the first time, which was the most amazing and magical experience I could have ever imagined. And also seeing an emergency cesarean, where they cut open your stomach and pull the baby out. And also I saw a 2-year-old baby being resuscitated and brought back to life before my eyes. But mostly what I saw was patient after patient suffering from the consequences of chronic, preventable diseases. Things like diabetes, heart disease, asthma, and poor nutrition. Things that in other countries are perfectly treatable if handled early and effectively. Something else that deeply struck me in my time at Sangla was the lack of resources. Things like clean sheets, stethoscopes, even working ventilators were hard to come by. Consequently, the doctors have to be very selective over who they treat. Many times, the doctors will favor the younger patients over the elderly, probably assuming that they have more life ahead of them. The hospital turns away people that can't pay as well. When a patient comes in, no matter how urgent their illness or injury is, the family has to pay upfront or little care is given. For a Balinese family, that money could be everything they have, and this decision could be life or death. This is what inspired me for this talk. What could I do personally to help people that were struggling with the Indonesian healthcare system? I started by looking at alternatives to the public healthcare system here. Alternatives that had demonstrable success rates and worked in the field with all kinds of people, not just people who had money and time and were privileged enough to spend their money and time on optimal health. I started by looking into Ayurvedic medicine. Ayurvedic medicine is a traditional 5,000-year-old system of natural healing that comes from India. Ayurveda started out as the science and study of life, and it literally translates to the science of life. To experiment if this was actually working, I called upon my dad. My dad suffers from high cholesterol and high blood pressure, as you can see. We consulted an amazing practitioner, Adam Bakhtai, and he gave us some herbs and treatments for my dad's blood pressure and his cholesterol. The herbs my dad was using, like garlic, worked amazingly, and his blood pressure reduced significantly. He hasn't had a high reading since starting, and he feels healthier than he has in a long time. But we didn't see any major improvement in his cholesterol. My dad, like many of us, is used to the quick results that allopathic medicine often delivers. This lack of progress slightly dampened our enthusiasm towards natural medicine, but my persistent mother has been keeping my dad on the program, and we're hoping that in the future it'll show some results. But I think that the good outweighs the bad and that his health is so much better. Ayurvedic medicine offers daily, low-cost, locally sourced medicinals to treat both the patient's symptoms and their overall health. The patients are encouraged to be very active in their own care. This self-reliance in a patient I see is extremely important for people struggling with their health in developing countries. I also explored meditative and guided imagery, holistic healing, and homeopathic remedies with Anne Hockett. Anne is a complementary medical practitioner. Her approaches emphasize viewing your body as a system, holistically. She inspires people to believe in their ability to treat themselves and take care of their own health. She empowers them to see how they can constantly influence their own care, their own progress, and helps them learn to read their body's own signs and signals. This treats people reliance on themselves instead of reliance on a healthcare practitioner. I also discovered that a simple change in attitude is key in treating yourself and becoming healthier. Now, these aren't These aren't just some new age hippie affirmations made to help people suffering from a bad week. I believe that they actually have physical and measurable change in your health. Take a look at the placebo experiment. Placebo experiments are proof that your mind actually has the ability to change your physical body. In 1999, Karolinska Hospital in Stockholm, Sweden, conducted a placebo experiment on 80 heart patients. Half of them were given heart pacemakers that were activated immediately after implantation. The other half were given pacemakers that were never activated. I know this seems really immoral, but it was the 90s. Things were different. But magnificently, after 3 months, both groups came back showing significantly improved heart function. They showed increased blood flow to the heart, and they all reported feeling much better. Allopathic medicine doesn't really support these kinds of ideals, like taking care of yourself or viewing your health systematically. It teaches people total reliance on a healthcare practitioner. I'm not saying that allopathic medicine is bad. It works amazingly. It's been studied and used for thousands of years, and it's saved lives. But I think in order for it to be effective in developing countries that are scarred by natural disaster and by disease, it should incorporate more of these ideals from natural and holistic medicine. One place where I've witnessed healthcare practitioners struggling with this dynamic was in the Philippines, where I traveled last year with Erica Carpenter and volunteered at Bumiwada, a clinic and natural birthing center that was established after Typhoon Yolanda. The typhoon devastated thousands of lives and killed hundreds of thousands of people. We had boxes of generously donated medicines stacked all over the clinics. Pills for anemia, diabetes, diarrhea, and other common health disorders that happen in natural disaster zones. We would get anything from 40 to 80 patients a day in the time that I was there. They all came in with pretty common diseases, but most of them were chronic. Because of the constraint of time and trained staff, those with the most common diseases were assessed, given medication on hand, and then sent home. This is unsustainable because the patients are then reliant on our medications. When we weren't permanent, most clinics, when they're established after disasters, are there for a few months, they treat most people, and then they leave. What about the people that are reliant on the medications that we give them while we're there? This is a common issue in clinics worldwide, especially in resource-starved first response settings. Because Bhumi Wada is this especially unusual combination of allopathic and holistic care, the clinic director and staff have worked hard to find a better way. Bhumi Wada is now applying for grants to start incorporating homeopathic and holistic remedies in their clinic. Hopefully this can encourage the patients to wean off their medicines and start relying more on their environment and on themselves for health. I think all of this can be applied in our healthcare system back here in Indonesia and anywhere in the world. I think that by incorporating naturopathic and holistic remedies into allopathic medicine, patients will have better tools and more low-cost ways to treat themselves and take action on their own behalf. I, as a future nurse, have a huge role to play in this. I need to help my patients take responsibility for their own health, and my attitude as a perceived expert is contagious. If I place power in my patients' hands, they'll feel empowered to treat themselves with my support if needed. And I encourage you all to start treating yourselves and looking into yourselves for your own remedies. And fundamentally, I want you all to unlock nature's medicine cabinet and administer the most powerful, no-cost drug on the planet. It's a drug that anyone can use, but is most important for people in disaster zones, war-torn countries, and places plagued by poverty and disease. This miraculous free wonder drug is the power of the human mind, soul, and heart to heal its own physical body. Thank you.